Today we are going to learn about peripheral neurons and ganglia. First, about peripheral neurons. I'm just going to get through all of you through some important points and mnemonics, not into details of anything. Peripheral neurons, according to axonal diameter and conduction speed, they are divided into A, B, C. A fibers have large diameter, so the classification is according to diameter and speed. A fibers have large diameter, whereas B fibers have medium diameter, whereas C fibers have small diameter. So when the diameter is large, there is less resistance, so the speed will be more. Speed will be 15 to 120 millimeter per second. Here it will be 3 to 15 millimeter per second. Then here it will be less than 2. Then our A fibers, they are further classified. They are further classified into sensory neurons and somatic motor. So this sensory is afferent. Afferent is further classified into 1, 2 and 3 fibers. Motor is further classified into alpha, beta and gamma. Now this one is further classified into A and B. A is it receives impulses from annulospiral endings, and B from Golgi tendon organs, 2 from flower spray endings, then 3 from temperature and pain receptors. These are efferents. These motor fibers, they innervate, alpha fibers they innervate extrafusal fibers, beta they innervate muscle spindles, gamma they innervate intrafusal fibers. Now in order to remember this 1, 2 and 3 of afferent fibers of A type, let's see a easy mnemonic or a picture. So this is nothing but, if you see, this is sense room, that is sensory fibers of A type. In this sense room, we have a flower vase, a spiral flower vase with an annulum or ring around it. So then it has flowers. Then the room has an air conditioner. This is the level of the room. So on the first level, that is the number 1 is annulospiral endings. The receptors are annulospiral endings. The second one, it is flower spray endings. Flower, annulospiral. Then 3, AZ, temperature. So temperature receptors. Next, our peripheral neurons can be either cranial nerves or spinal nerves. Spinal nerves are mixed nerves, that is they have both motor and sensory root, whereas cranial nerves can be either motor or sensory, or it can be mixed. So it is really important to know we have how many pairs of cranial nerves. We have nearly 12 pairs of cranial nerves and 31 pairs of spinal nerves. So in this 12 pairs of cranial nerves, it's really important to know like which are motor, which are sensory and which are mixed. So if you remember any 2, we can make out the next one. For that, for sensory it's not much difficult. Senses, we have to just remember about eye, ear and nose. So here comes the sensory cranial nerves are optic for eye, olfactory for smell or nose, and for ear, yes, it is vestibulocochlear. Then the 2 remaining are motor and mixed nerve. So let me give you a mnemonic to remember about mixed nerve, so we can easily make out the other one, that is the motor nerve. So here's the mnemonic for mixed nerve. Mixie's face glosses like 10 gems. That Mixie, that is for mixed nerve. Mix is face, facial nerve, glossus, glossopharyngeal, like 10 gems, 10 for vagus nerve, 10th nerve, facial is 7, glossopharyngeal is 11th, sorry it's 9th, then gem remembers us for 5th nerve, that is our trigeminal nerve. Next, it is important to know about plexus. Plexus are a network of nerves in the peripheral nervous system. There are 3 main plexus: cervical, brachial and lumbosacral. Cervical, it supplies it has 2 nerves, greater auricular nerve and lesser occipital nerve. Brachial plexus, it supplies upper limb muscles. Lumbosacral for lower limb. In order to remember, so it's important to remember their root values. Their root values are, so in order to remember them, the plexus, we can visualize it written as this, that is plexus. This resembles 14, the numbers 1 and 4, 1 and 4, 1 and 4. It is very important to remember these numbers. So C1 to C4 is our cervical plexus, then L1 to S4 is our lumbosacral plexus, then after 4 we will have C5. So C5 to T1 is our brachial plexus. Again here L1 to L4 again is our lumbar plexus, and the remaining will be our sacral plexus, that is the lumbosacral plexus is divided into lumbar plexus and sacral plexus. So by remembering these 2 numbers 1 and 4, we can easily make out the root values of all the 3 plexus 1 and 4. Now let me tell some clinical points. Neurotemesis, axonotemesis, neuropraxia. A nerve has a nerve fiber. Usually we say the extension of the nerve cell body as the nerve fiber. So it will have its axon and myelin sheath. Axon and myelin sheath. Neurotemesis, the whole nerve fiber is damaged, that is axon and myelin is damaged. Axonotemesis, only axon is damaged and the myelin sheath is preserved. In neuropraxia, both axon and myelin sheath are preserved. So this neurotemesis is a severe condition, but these 2 types, they can regenerate and the normal function can be restored. And another thing about this Fraze syndrome. Normally when a neuron has a lesion, it is cut into 2 parts. When this happens in mixed nerves, for example auriculotemporal nerve, like for Fraze syndrome, it is about auriculotemporal nerve. So when a mixed nerve like auriculotemporal nerve is cut, it has several fibers, motor, sensory and autonomic. So while regenerating, when the motor fiber may grow into the sensory fiber, the sensory may grow into the motor. So like following auriculotemporal nerve lesion, if this happens, we will have Fraze syndrome. So we will have altered sensation and paresthesia. So here we can see for the plexus, here we can see C1 to C4 is our cervical plexus, and then it is L1 to S4 is our lumbosacral plexus. So 1, 4, 1, 4. So after C4 we can remember it as C5 to T1 is our brachial plexus. Cervical, brachial, lumbosacral. Next, this is how nerve is cut. So here it is cut, and then it's like again this will form sprouts and it will start growing. Here this is a single neuron is shown, but when many neurons are there, and like if it, like one type neuron grows into the distal portion of another type neuron, we will have the Fraze syndrome. Then having a look at the ganglia. Ganglia, it can be of two types, sensory ganglia and autonomic ganglia. Sensory ganglia is mainly a dorsal root ganglion, sensory afferent. Then autonomic ganglia, it can be sympathetic or parasympathetic. Sympathetic, it is present in the paravertebral region, two sides of the paravertebral region, or it can even be in front of the vertebra, that is prevertebral. So it is of two types. Here this dorsal root ganglion is nothing but the aggregation of cell bodies of primary sensory neurons. This autonomic ganglia is nothing but it represents the synapse between post and preganglionic neurons of autonomic nervous system. Here we can see we have our sympathetic ganglion here and dorsal root ganglion here. Dorsal root ganglion is from primary sensory neurons and it is a collection of cell bodies. Then here we have sympathetic ganglion which represents synapse. Then moving on to some clinical conditions. Neuritis. Neuritis, or it is also called as peripheral neuropathy. It is the most common disease in the PNS. Here what happens is that the peripheral neurons degenerates, that's it. Peripheral neuropathy. So degeneration, something is degenerating, peripheral neurons are degenerating. So here the distal portions are affected first. So we will have our symptoms first in our hands and foot. So this is called glove and stocking paresthesia. Esthesia means a sensation, para, altered sensation. Then we have our entrapment syndrome. Entrapped means like something is trapped and compressed. So in entrapment syndrome there is compression of peripheral nerves. Example is our carpal tunnel syndrome. Then we have radiculopathy. Radical, like we say, right, when a seed develops first it will give out a radicle and it will then develop into root. So radical, it is related to root. So radiculopathy, pathy in the sense damage. So we have our damage of nerve roots are damaged. Some familiar examples and most common example is spondylosis and disc prolapse. Disc prolapse. So thank you. Bye.